Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers.
I just met with Jason Weingarten. He's a clinical psychologist and kind of cool. He's actually works bicoastally in Manhattan as well as San Diego. He's one of the founders of NYCBT. It's a DBT group practice in New York City. He's also a staff psychologist at the DBT Center of San Diego. And we talked about the atmosphere of adolescence in 2020 and some of the challenges facing the contemporary adolescent in an age of technology and information like we have now. And just a lot of different pearls of wisdom and insight about parenting and about kids, adolescents in particular, and some thoughtful ideas about how to handle information that's heavy, how to validate and help understand the pressure of the contemporary adolescent, and also how to address behaviors in a way which promote reinforcing desirable behaviors, but also help to reduce behaviors that aren't working. So I hope you enjoy this. Thanks so much.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
Hi, good morning. It's a Wednesday morning, February 26th, and I have the distinct honor of having Dr. Jason Weingarten in today. Nice to have you.
Nice to be here.
Let me qualify. I have you in by phone. Jason's in San Diego, and we've been able to do some great phone recordings for this podcast. So I'm just really grateful that we have this technology, that we get to have discussions across the country. And today I am interested in talking to someone who has his finger on the pulse of the world, adolescent and adolescent parents. And what do I mean by that? I'm so interested in what is the contemporary struggle of the American teen. Now, I know that's a big statement in terms of, different cities, different locations, different cultures within, right? And different backgrounds. But when I think of the teenager of 2020, right? And I think back to my teenage experience and my parents and I can think of my own kids and like, I just laughing because my daughter was telling me it's time for a charity project at our school. And I was saying to myself, and facetiously, I said, are you guys going to fly to Fiji or something to get to, what's the, what kind of luxury item does your school have for you to do high-end charity? And when I went to a similar schooling system, that was just not even the idea of taking a plane somewhere. I'm not that old, but this reflex to travel. I'm just going to go here for the summer. I'm going to go there. It's going to Europe, and it's just I'm watching something that I didn't see at all, and maybe it was an issue of resource that some people didn't have the resource, but I just don't think it was part of the.
No, there's greater access now.
Way greater access. So with all that, I'm like, and also a lot of, and I'm watching in some ways as a positive, better emotional language and more, like words like emo and rehab is a household word. Not, but there's something about your anger management and just different concepts or therapists, or, it's much more part of the vernacular. But at the same time, I feel like it would be helpful to have discussion about what is the challenge and what is the atmosphere of parents and children. So with that introduction, welcome, Jason, and I'd love to hear your thoughts.
Absolutely. Well, thank you for having me, Adam. I do come with a slightly unique perspective, and I don't even know if I mentioned this beforehand, but my wife and I also have 2 adolescent brothers. So I have that personal perspective as well, a 17 and 15-year-old, as well as the past few years working a lot more with adolescents and their families, the parent training side, and running some family groups and such. But just paying attention to what's happening in the world and reading certain stories and finding myself more fearful as I read certain things about, like I said before, access and some of the technology and ways in which it's been wonderful and great, and ways in which it has made a lot more things and a lot more people accessible and reachable, and sometimes hard to fully understand the wealth of information that somebody so young can take in now that the internet and other things exist. So a lot to talk about. Certainly changing times.
So when you're a private practice practitioner, bi-coastal, so you have a flavor of New York City, you have a flavor of San Diego. What are you noticing in terms of the parents and the adolescents, the young adults coming in? What strikes you in terms of discussion points?
Yeah, well, so there definitely is similarities. Adolescence is kind of stereotypically known as the stormy times, and so much change is happening. So some of those things, fighting with parents and, social changes, first relationships, things like that are all fairly similar. I think that a lot of the change has come with the internet and with how much distraction, connections, access to things there are now. I was just thinking about how, I'm sure during adolescence, kids snuck out. But now you can sneak out, get an Uber wherever you want on some gift card that you got because you had the information and were technologically savvy to get that information. And I just think, wow, like when I used to sneak out, I used to have to go somewhere I could walk, and it was limited. And there wasn't a lot of other things. And so that's just one of the many ways, access to, illicit drugs through the internet, and certainly people, which could also be concerning. Mm-hmm. And then the idea that, anything you put up on the internet, anything you send to somebody is potentially there forever. And that's a really new issue that comes up, I'd say, over the past few decades, but coming to a head more recently with the advent of so many of these social media apps and things that promote, communication and pictures and such. We see a lot of that.
Right. I remember when I was a kid, if I wanted to call, we had to use the phone. So I just, if I got scared, I can just hang up on whoever answers the phone. So there's that's not imprinted until they developed caller ID, which changed that game. But there's
no question.
So what you're saying is it's in the age of this degree of available information and technology, it's hard to hide.
IP addresses. People know where you are, and all of a sudden you don't realize that. And then, people can really narrow in.
So the whole game of sneak, right? Which is what you're saying is we're going to accept this as a point of fact that not all, but many, enough to say it's super common. Many adolescents want to find a way to sneak, to get away with something that they're not supposed to do, right? Yeah. And it's just much easier in 2020 than it was when people started writing about adolescence.
I'd say easier and more dangerous. If you're getting in a Uber or a Lyft, or you're getting into a ride share and it's late at night because you're sneaking out, you're essentially a teenager going to a stranger's ride. Mm-hmm. And I'm sure there's rules and regulations. I'm sure there are things that cover things, and I'm sure there's ways around it. So if you're on the internet, even and the access to people, desire to connect, you have both the ability to be found very easily, IP addresses, cell phones, all the things related, and the ability to hide more dangerously. fake profiles, rooms and connections with people where, you're not necessarily 18, but you can get through and you're saying you're something else. And you can really hide, and you can really kind of have this dichotomy of being very, very accessible and people knowing where you are, and also being very hidden. Mm-hmm. And I think within those two realms, we see a lot of trouble, and maybe even more so because there's many more roads in those realms than there were before.
So the hiding, the technology, what else are you noticing in the world of adolescence and family?
Yeah, I think just information shows the ways in which things are discussed now in some way is great because it brings it to light, and it allows for platforms and certain shows and certain topics and certain websites and other foster discussion, which I think is great. Other times, it's a lot of really mature content that is very accessible, and I think raises a lot of questions that don't necessarily get addressed or talked about. And so people get ideas and people learn things, and there's certainly kind of a contagion effect to some degree of reading something, watching something, seeing something, and then essentially thinking about it, maybe not having an outlet. And that's, I think, leading to many more people taking that leap to either self-injury or substance use. And I don't want to say it's because of the media, but I think when you're seeing it pretty vividly, in 4K, high def, and a lot of the cinematography that goes into it. I think it's alluring. And for teenagers, it's really kind of that was change and experimentation are some of the hallmarks of that time.
It's interesting. We're talking about this as it's not an either or. It has elements that are helpful, and it has elements that may not be helpful. And my take on it is information is great. It shouldn't be hidden. It just should be available in a way that's that I'm prepared to help someone deal with the information. So it's there. I like the idea that there's both. And if you look at the theme in this, to me, is that connection. It's a great thing. There were so many people when I went to high school in the 80s. It captured a time where the quote unquote nerds were they were trying to unify as a group, right? And the movie Revenge of the Nerds, a marginalized group who banded together as in a way of connection. So there's this element of it's much easier to find insta connection and a community of sorts, which is great on the one hand, but challenging on the other, because some of them have components that are potentially compromising and lead to a lot of sneaking and a lot of potential information that could be challenging for a person to digest. And you're saying also that not a direct relationship, meaning it's not a causal effect, but that it's possible that the burden of that creates anxieties and symptoms.
Yeah, I think there's, again, like you said, there's, and I know not really diving into the correlation of things, but when, 13 Reasons came out, that was a very big topic. We, saw an uptick in those discussions, but also in discussions about suicidality, suicidal threats. I just anecdotally was interested to see how many people had come in first time self-injuring with cutting or something of the sort, or first time threatening suicide during kind of that, 6-month, 8-month period when that show came out. Mm-hmm. And so I don't think that it's because of those shows that these things are occurring. These things have been occurring for years, for decades. But because there is a lot more of the connection and communication and information, it's helpful, and it could also be concerning. If your 14-year-old is connecting with a group of people who are talking about suicidality and self-injury, and it's not regulated, that might not be the greatest outlet.
Right. It deserves attention of primary caretakers and teachers and anybody in someone's life in a position of any sort of helping position to be aware of that. There's a show that I haven't seen, but it's apparently captures adolescence. It's called Euphoria, and what I know about it is it's highly sexual. It captures drug culture, bullying, all these hot topics, and in a certain way, in a certain way. I know my daughter. I have a 16-year-old daughter. She says, "Dad, I'm not watching that with you." And
Right.
there's no way I'm watching with you, but it captures her age group. And
Yeah.
I wonder if you think that those sort of, when we put out something like the 13 Reasons Why, and we put out shows like that, is it your sense that they're giving a responsible, accurate depiction of a day in the life of, teenager America?
If you think I'm going to let the power of Netflix come down on me like that from weighing in on some of those, you're crazy. No, I think that to some degree, fostering the discussions that come from those shows is great. I don't think that networks and people are thinking about the social benefits of these shows. And I imagine there's some social responsibility that goes into thinking about it, and to how things are done. But I imagine they're focusing more on viewers. So I don't, not judging it, but if then those viewers can talk about some of these issues, if parents can follow up, maybe not watch it with your kid, but maybe follow up, find out what they're talking about, find out what the topics are, maybe watch it on the side and see if you can even get into the discussions. Because I think that's really important. If they're talking about drugs and sex and experimentation and pressure, social pressure we haven't even gotten into yet, which is different now than it was. I think those are great topics to talk about with your kids. And it's not going to be a conversation you have one time. I mean, these are going to be ongoing discussions as they learn more and they change and they experiment. And you're going to continue to worry and be interested. And so just having that soundboard that they can come to, having that place where they can feel comfortable not getting punished because they did something, that's a really quick way to get your kid not to come talk to you. Is even though they're telling you something that you may not have wanted them to do, but they're bringing it to you. That's really important.
Right. So you're saying that with all these things, it's, and again, I like it's not good or bad. It's what do we do? What is the responsible way of approaching information, and is to have a platform for safe discussion where some of the stuff that comes up in that I have available to me, adults who have a thoughtful take on how to navigate those challenges, or whatever content is coming up that's confusing, right? That I have somebody to talk to, and that if that channel is shut down inappropriately, then it's not of service to the adolescent. So, that's a take home point to parents. I want to move into the what are you seeing in the offices, and when you do these parent groups, or when you're educational groups, or when an adolescent comes to your office, what are the types of issues brought to you that you're seeing that may be and when you answer this, what would be helpful to a clinician or someone who works with adults who have children? What issues are you seeing surfacing?
So, some of the issues haven't really changed. There's self-injury, there's suicidal threats, there's defiance, there's school performance, there's school refusal. Those change and shift a little bit. There's some nuance to some of the changes within them, but they're pretty much consistent. Some of the newer stuff really, and I don't want to get back into it, but I think the more technology side and the ways in which people can rebel and such. So I would say we still mostly get people coming in with self-injury, suicidal threats, extreme anxiety. I mentioned before social pressure. And I think that really has an impact on mood and anxiety for a lot of teenagers who are already kind of, emotions and body changes and things going on. It's societal and possibly parental, sometimes even social pressure from friends adding on to that. So that's when we see, kind of impulsive behavior. We see people trying to not feel some of those things and avoid, and or do something to not have to feel that pressure, to feel that pain.
Mm-hmm. So the kid comes in and the social currency is, I like it when people say like, hey, I'm 40, I'm in, it's high school for adults. Like I live in a community where it's high school for adults. It's implications. The currency is currency, but there's a dimension of social currency, but there's other currencies too. In this landscape, the primary currency is social, right? And the pressures of of that social currency, what that looks like is, and if anybody's listening to this with children, it's so immense.
Yeah.
And it's so immense, so much so that the burden of that pressure results in symptoms, meaning high anxiety and so wanting relief on the one hand from the anxiety, but also wanting to gain, to increase the social currency, right? And your currency could be, I'm a badass. But you can have badass currency.
Totally.
You can have cool kid currency.
Cool kid currency.
And you can have academic currency. There's all
athletic.
Athletic currency. There's all different spaces of currency. And either it doesn't matter which one you're in, meaning if it's to you about making the lacrosse team, right? Mm-hmm. And to the other one, it's about getting into a good college, right? It's the magnitude of the feelings. It's just, I know that from research, there's definitely a heightened memory and fear is, fear memory is much more impactful. So is impulsivity in the developing brain in adolescence, from what I know. And so you're just, and there's also this idea you spoke about before of it being a first. So yes, all those things are walking in, and you see them in the form of, I just want to die. And I want some relief from potentially from harming myself, as one way someone walks into your office, right?
Yeah.
What other ways do they walk into your office?
Sometimes they walk in and you're wondering why they're there. And then a few minutes later, they break down crying because they are so good. They're the straight A student. They're the president of the class. They're the, everything looking so great. And if you're, the metaphor of the duck floating on the pond above water, so calm, so wonderful, and then paddling ferociously below to stay afloat. And so that comes in also. Right.
And so they come to you and they're on the outside, everything's good. But the moment they have some room, right, it'll come out. Just the gravity of the pressure will come out. It's a pressure.
Absolutely.
Cooker. So,
or it's come out, right? They break down and they say, I've been using drugs every day at night. My parents don't know they'd kill me.
Yeah.
Or, so it's not necessarily just the moment of the break, but what's happened since.
What do you mean what's happened since?
Meaning sometimes they come in and it's not that, I'm feeling all this pressure now in this moment. It's like I've been feeling all this pressure for years. And I've been doing I've been using substances or drinking every night to go to sleep. And I've been, other things related to just not feel that pressure, to release that.
Right.
And now I'm struggling because, even though my parents don't know, I'm screwing up my classes, my boyfriend's mad at me or whatever it might be.
Right. So I'm psychologist. I'm sort of taking this all in with a full awareness. And this is the I think which would help me get better, right? A full awareness that at that age group, right, in that frame, that time frame, there's such pressure in relationships, all first experiences, and that high anxiety of high school is a tough time. It's a really tough time. And I once read an article that the top of the heap, there are very few spaces for the top of the heap, meaning the confident, comfortable, for lack of a better word, alpha person, right, is, they may exist in very small numbers, but most of the people who are allegedly in that space are actually terrified of losing that currency. And terrified and willing to knock people out, i.e. bully, right? The people below them in the hierarchy, social hierarchy, just to maintain. So in a sense that they're maintaining their space in the social ladder. And that's just, I need to know as clinician, I need to know what am I looking at and not minimize and say, oh, this is just a phase, you'll get over it, it's going to be so much better, there's life after high school.
Right. That comes with great intentions, right? Like that comes with great intentions. It just has the probably opposite effect of what you're intending to do. Telling somebody who's going through high school and all the emotions of a first breakup or social pressures or failing that first test and wondering if their friends are getting ahead of them and are they going to get in that school, telling them that it'll get better and it'll pass and it's just a phase, it doesn't even register. That's like, it's probably going to piss me off.
Yeah, I sometimes wonder if there is a sense of the immediacy and the experience of urgency that comes with these social pressures is so intense that it's hard to see anything. It's hard to have long-term planning. It's hard to have vision, possibly because it's such a heightened time of development in terms of establishing what works, what doesn't, right? What is dangerous, what's not. But that perhaps, and maybe this is studied, perhaps their notion of time is different than a more developed brain and a more adult brain. Their whole concept of time, me saying to someone it's going to get better over time, may not be so comforting.
Absolutely.
So,
especially when you think about just in that moment, right? Like in that moment, the emotions they are experiencing are happening in that moment. That's what they need, is the ability to get validated in that moment, to share openly. Because yes, things usually get better in time. We know that. And there's a lot of things we know that they might even happen to know. But right then and there, we miss that opportunity to really connect and to really make them feel heard, to help them understand their emotional experiences instead of getting away from them. And that's the function of a lot of the dysfunctional behaviors we see, is trying to escape difficult emotions or situations.
So another take-home point, right, is the first one is about the availability of space to share. Similarly, right, to not run away from real-time emotion and sidestep it, because if I think what you're saying is if I sidestep emotion in the here and now, right, I'm going to start building an account of I'm holding on to stuff that I'm not addressing, and that's not going to work. So part of it is giving space to allow someone to have that emotional experience. You know, you're invited to it, and if it's a struggle for you, I'm going to help you.
Absolutely. And I know as parents, people are busy. You don't always have, it's excellent if you could do it in that moment, but sometimes you can't. You don't have 20 minutes to really break down a really emotional moment, but then put it on the agenda for later that day. You know, when you have a chance, if you're done doing what you need to do, come back to that kid and say, hey man, what happened after school today? I knew you were really upset. I didn't have time when I picked you up, but you know, now I do.
So walk me through, we've just sort of captured, you know, teenager 2020, you know, all with a broad stroke. In a similar way, you know, the parent is involved, right? They're concerned. I would have sometimes concerned, sometimes who knows. But what is your experience of the parents?
Parenting's hard. Parenting's tough.
I have 4 kids. I get it.
Oh man, you said a 16-year-old, like, whew, adolescence for that. So I got a 1-year-old, and I'm already like, I would never trade tomorrow's problems for today's. But with that said, I think parents have a really tough job, and it may be even tougher than before to some degree because their kids are armed with a lot more information. I would say that for the most part, parents' intentions are usually great, right? I want to help my kid. I want to bring relief. I want to, you know, feel like I'm being supportive and helpful. It's just how parents do that, I think is sometimes misguided. For example, I think kind of the over or under responding to things is something I try to help parents with. You know, your kid does something that would be kind of considered typical adolescent behavior. You know, there's a little bit more moodiness. The room's a little bit more of a mess. You know, they're upset over a breakup. They, you know, a little more argumentative than before. You know, you find out that they have a boyfriend and you think they're too young kind of thing, and people over respond. Now, I know family values and other things are integrated into that, but the over response to like a fairly typical adolescent behavior, you know, the intent is to, I'm sure, keep them safe, or I shouldn't say I'm sure. What I hear is to keep them safe and to protect them and to give them values. And yet sometimes that over response is pretty punitive.
What do you mean by what's an example of an over response?
You find out your 6-year-old went to a party and maybe has a relationship, or maybe went to a party and kissed somebody, or something more to that degree. You found out that you picked them up and you saw them making out in school, whatever it might be. It's fairly typical. Mm-hmm. You come back, you punish them. What I tell you about dating, you're too young in that regard, and you punish your son for the next 2 months. They can't go out at all.
Right. So you shame
Well,
them. You shame.
Yeah, and they're thinking, well, exactly. Not only what did they learn from that experience,
Mm-hmm.
which it's pretty typical, and yet you're treating it like it's a crime.
Mm-hmm.
And the punishment is so severe that if I was that adolescent, I'd probably just get angry and resentful. I don't think I'd do much insight or be interested in talking about this topic that clearly we don't necessarily align on.
Mm-hmm.
Same with go ahead.
I'm just thinking about the drug and alcohol. I work in in addiction, and this sort of like terrified. I'm thinking of a terrified parent. My kid's smoking a lot of weed, and I get the fear, but it's so early on. It was so pronounced, and we're waging war on this. Drug tests, and you're going to go away for a year, and there was no real. It hadn't launched. And that so I want to get every single specialist, every single person. We're watching you 24/7 before just from an experimentation piece, not when. And I want to clarify, not when someone's in an active addiction.
Right, and that's where it kind of breaches over to much more cause for concern. Right, there's obviously continuums for these things, but yeah, for experimentation, that type of anvil response, right, that sledgehammer to the problem, I don't think is as effective.
That's an over response. What's an under response?
Your kid gets caught cheating at school because they stole the test and made copies for their friends and sold it, made a lot of money, and they got caught. And then you go to the school and you try to get them out of trouble because you don't want it on their record and you don't want it to impact their college career. Because God, the college or future, how could I impact that? As a good parent, shouldn't I be willing to do what I need to get them out of trouble, to keep their pristine record so that colleges accept them?
Right. So in both those cases, in under responding in that example, which I've seen before too, like I just had a case of a kid didn't make the basketball team, and like the mom is, it wasn't the captain of the basketball team, and this is all part of the packaging of the application.
Mm-hmm. Of course.
And it's 10th or 11th grade, and the mom is on a tear. To try to get the school to change the terms of captaining, right?
Yes.
So we need 3 captains or 2 captains or whatever it is, but it's urgent. In both those, in organic consequences, in both those examples of over responding and under responding, are inhibited.
Correct. So then the learning is inhibited.
Right. So this is one thing you see with parents coming in is
totally.
A lack of perspective, but also behind the lack of perspective, I'm guessing a sense of there are critical things that must happen. Like my kid can't. Yeah, there are pressures. My kid can't be a certain way. They can't be They can't be a fuck up. Right. So fuck ups, make out at parties. Fuck ups, smoke weed, and I'm going to clamp down on that.
Get a C on your midterm, right? Like things that would be like, happen, right? That you can't be a fuck up. You can't have those things that would hurt your chances, and then it's like the idea of we've worked so hard, right? So it's the layered pressure of things that come up.
Right. So no, but
the under response, and the under response doesn't allow for, like you said, the organic consequences or the natural consequences of what that person would deal with, unless that parent is willing to walk 15 years from now, walk into their kid's boss's office and demand them to get promoted when they got bypassed. Then we got to change that, right?
Well, no, and by the way, I think in terms of, some of the media I've heard about this is there does exist parents who will in their kids' 20s come in and argue with the supervisor of, please promote my child or don't write them up. Right, my young adult, child. So in that case, there is also a messaging that organic consequences and life consequences there's always a way to get out of trouble. There's always a way for someone to intervene on your behalf and rescue you from discomfort.
Yeah, which makes it more likely for you then to make the same mistakes.
Right. So from a learning perspective, I'm being taught that I have bailout packages all the time. And we know that it's
not a big deal, right? Like that thought comes up, it's not a big deal. It's not a big deal.
So how do you work with parents?
Yeah. I wanted to make a snarky remark there, but I'll just dive in. Typically what we try to do is to have the parents understand what they are doing and what they're trying to do, and the ways in which it's working and not really necessarily working. So what's effective and what's ineffective from the approach they're taking and the goals they have.
So I'm a parent, I'm coming in, this all sounds reasonable, but I am so determined, and we'll use sports. I am so determined that my kid is going to need to be, Mamba mentality on his or her way to a D1 school, and this is essential. This is essential beyond essential. And here's this, I'm going to judge. I'll throw out I'm the parent. I have a whole story about what it means to be a mental health professional and what your leanings are and all that. And you're going to tell me to ease up. So how do you approach that parent?
So I just want to clarify, in this case, it's actually the parent's behavior that's the problem. So other than typically I'm teaching the parents how to manage their adolescent's behavior. In this case, it's actually the parent behavior, right? It's this warpath that this parent is on. So just a little bit different. I just wanted to align that.
Right. No, but from a family systems perspective, right? You're indirectly helping the family, but you're addressing the symptoms of the parent to alleviate the pressure of the child.
Right. But the reason why I highlighted that is typically I'd be talking with the parents about what the contingencies are, right? Like, what are they doing in response to a behavior? Are they reinforcing it or punishing it or ignoring it? What are they doing? Here, I'm going to link it back to the kid, but it's really the parent behavior. Mm-hmm. And so, parent comes in with the context you just gave. I might start asking questions. I'd probably take an easy questioning approach with some validation about the importance of certain things to a degree, about why this seems to be, the only way for this goal to be achieved. Maybe asking questions that highlight some of the consequences that they're not necessarily looking at. Most supervisors and coaches, from what I understand in my own experience, don't love the parental feedback and or the threats that come with things. So I don't know if that's been taken into consideration. Mm-hmm. How does their son or daughter feel? Have you asked them? Do they want to be captain? And if so, do they want to be captain this way?
Right. Is it worth what is the cost? At what point is it not worth it?
Whose cause are you championing? Is this, and I wouldn't necessarily say it that way, but that's kind of what I'm getting at is, what are you looking to do? And are we sure everybody that you're pulling for is on the same page and in the same way? Because if I'm a 16 or 17-year-old, basketball player at my school who didn't get, the captain role, I might go home and tell my parents I'd like them to advocate for me. But I also might not.
Right. So you're saying getting to know who are we dealing with, the individual, versus your agenda as a parent, right?
Because ultimately my goal with the parent in that moment, if we go right back to that scenario and that vignette, is to teach your son or daughter how to advocate for themselves with the coach.
Right. Right. And not be a chronic rescuer.
Of course. Aren't those skills going to be important when they're going to be negotiating for their raises or their promotions, or when they're talking with a professor a few years down the road about a grade? These are the skills that, and then if it's really their goal, then aren't they the ones, right? It's their captainship. Mm-hmm.
It almost seems intuitive that you're going to try to create, cultivate a sense of agency and, and personal responsibility. And I know that this seems obvious. If somebody is in the world of addiction treatment, this is an obvious in the world of codependency and addiction and Al-Anon and AA and all that. But even amongst, Jedi Knights in AA, right? Mm-hmm. When you have your own kid, right, I think it relaxes standards, and it's very easy to lose sight of learning the skill set of advocating for myself. I want to switch gears to this word that when I was coming through, going through my own training, the word punishment was seen as a very bad word. We changed it to response cost, and it implied it had a connotation that just like the word diet may be a bad word, it could be, but it also could just be that which I eat, right? Yep. So in the use of consequences or punishment, or however you want to say it, you mentioned earlier that some of what you're doing is trying to fine-tune, wait, I forgot what words you used. Over responding and under responding. So some of that is tied into appropriate consequences. Tell us about that.
So just a real quick kind of psych 101 for the audience. So when we talk about behaviors, when we talk about reinforcing behaviors, it always refers to increasing the likelihood of them occurring. When we talk about consequences or punishment, it is decreasing behaviors, like decreasing the likelihood of the behavior going forward. And so consequences and punishment is really looking at decreasing a behavior. So reinforcement, increase a behavior, punishment, decrease a behavior. The terms positive and negative, positive reinforcement, negative reinforcement, the terms positive and negative really only refer to whether we are adding something or taking something away. Are we adding a reward or taking something away? So positive reinforcement is adding something desirable to see a behavior increase, right? A sticker for a test for a first grader for doing well on a test. Adding the sticker, increasing the likelihood that hopefully they study more and perform well. And so those concepts are really, really important because we do know that we get more work done and shape behaviors easier with reinforcement.
With positive reinforcement.
Any type of reinforcement. Positive reinforcement is wonderful, but if I remove a negative, it's also, right? So negative reinforcement, removing of something that is undesirable, is also going to increase the behavior.
So it's a more of a, you're saying, my goal is to increase the desirable behavior, period. Right. Whether I remove something or I add something, right? Positive or negative, that's the end goal.
Right. Your 16-year-old daughter does really well in school, and so you extend her curfew, right? You remove these limits. That's negative reinforcement because it's a desired outcome by removing certain limits.
Right, which is doing well in school.
Right. And so we know that we get further with reinforcement, and we want to use that as much as possible. We actually want to hold on punishments as much as we can. Typically, we promote ignoring because ignoring does not give the attention that punishing does. It does not lead to the combative nature that punishing does. And punishing, like I said before, if it's seen as punitive, doesn't really promote new learning. It usually leads to more anger and resentment. And unless somebody returns back, it's not as if then the learning piece about what had happened before was actually addressed. Mm-hmm. Ignoring gives them time and space to hopefully do the thing that you talked to them about doing. Prompting them can hopefully remind them about it. And then when behaviors really do stretch into a certain level, when it's really more egregious, that's when punishments would hold. That's what I would say. That's when we would evoke the punishment.
So as a first line preferred intervention, we go with reinforcement to increase the desirable behavior. However, and furthermore, the first line of undesirable behavior isn't going to be, to over respond, but actually to not even respond, which is, I like to say to people, we don't meet urgency with urgency. If your experience is that this is an urgent matter, if I match your urgency, it's not helping. So one of your interventions is don't respond, ignore, right?
Right. Now that's when this has been a discussion that has happened before. And typically the adolescent knows what behaviors that is desired.
Right. Yes, and that there's been a whole there's been a formula discussed of how we're going to address issues. However, if the behavior becomes super egregious, right, like the one where they steal the test or
steal the test, selling drugs at school, stole a car before you had your license and crashed it.
Right, stole from your parents, took their credit card, beat somebody up, right?
Yeah.
Punishment is
punishment with explanation of what the punishment is. With clarity. I think clarity is important for punishments. I also do this with parents. The idea of you'll get it back when I say so, or you'll get it back, or you'll never. It's like that's going to probably lead to learned helplessness, right? If they don't know when the consequences are ending, or they don't know what they can do to influence it, that's going to be problematic. But for something like that, that is punishment, and that is punishment that has them understand what they're getting punished for and for how long, and then what would be needed for repairs. Like what they're going to need to do before we even start introducing some of the things that they lost.
Right. What is your repair road? And also, what does it mean to buy back trust or earn back anything? And what I'm hearing in this in general is it's nothing you're saying is knee jerk, and nothing that all of these tips are interventions that require thoughtfulness and a sense of, you have to have some sense of self-awareness too, because if your agenda is disrupting this, you're not going to implement effective reinforcement or punishment.
And if you're not consistent with it, then you're going to actually do more damage through intermittent reinforcement. And what we mean is actually giving in at a higher level of distress because you're maxed out, or because that urgency kind of tips your scale, when continuing to ignore would be most effective, so that behavior will extinguish.
Right.
The teen whose cell phone you took away because they did something that required a punishment, and they're yelling at you, they're slamming, and they keep going, and you ignore and you ignore and you ignore. And then you react when they finally slam your door. That's a problem. Now they know that if they escalate the behavior to a degree, they'll get a response. Whereas if you continue to ignore, eventually the kid will calm down, probably go to their room and cry or sleep or whatever it might be. But that behavior of the, reaction of slamming doors and yelling will cease. Right.
So relaxing the standard of a plan, right, to increase desirable behavior or to punish a behavior, the inconsistency of it or the overuse of it is what you work with, is what you're going to be doing with parents to help with behavior, help with symptoms, right?
Yep.
And overall, and we'll sort of, I want to end with this one. When this happens and the atmosphere has consistency and a reasonable understanding of what to expect and how the rules work, what happens to symptoms? Let's say other symptoms, anxiety, besides behavior. Do you notice a change in symptom presentation just from that alone?
Typically, yes. Having like a behavior plan in place or some clarity and a structure to what will happen, like the contingencies and how they'll be managed, I often do find helps reduce anxiety. And if they're doing the things that they are asked to be doing, that's usually helpful for everybody. Parents might have a desired, it might be parents' desire, but often typically helps the adolescents as well. Then, we see behavioral activation because they're doing more. They're engaged in school. They might be going back to their sport program or their after-school activity. Social opportunities are there. And with clarity about what to be expected, what rewards will they earn if they do the things that are difficult but possible, and maybe what punishments or things are in place if things reach a certain level, then I think it reduces anxiety about what to expect when.
Interesting.
So I also, hold on.
Sure, go.
Adolescents are still going to have mood and anxiety stuff go on, even if the things at home are great. Because like you said, the social currency and the social domain is so impactful that everything could be wonderful at home, and the first breakup will devastate somebody. So it's not as if that's the answer, but I do think it's really helpful. And within that, it then also does spark and foster communication about issues. If the teen or the adolescent disagrees with something, talk to us about it.
Yes. And we had touched on that. I want to just in the interest of time, and I'm going to put you on the spot a little bit.
Yes.
What's an example of a situation or a family that just blew you away? Like, wow, we did some of this intervention, and wow, I am so amazed at how at the change.
I like that question. I thought you were asking a different question at first. But in terms of the turnaround and the change from the work that was done.
Mm-hmm.
So a couple come to mind. I guess one in particular, it had to do with a family style and certain family values where the family really, really rewarded academic achievement. And their adolescent, they had 3 kids, and 2 of them, kind of fall in line. And the other one had a little bit more of like an artistic bend. And so that bent didn't always align with the family values. And so a lot of arguments, a lot of discussions, the kid feeling really invalidated, even when they did things that they were really proud of. And the parents feeling like they were failing. And essentially the communication was mostly arguments and locking in rooms and comparisons and this divide that had occurred. And so by having everybody come in, I was initially working actually with the teenager. Working with them initially really helped, but we bring the parents in periodically. And then the treatment transitions from kind of a adolescent DBT where I'm meeting individually and having some groups and skills to having the family come in almost every second or third time to talk about some of the emotions behind the communication. Parents' fears about their kid, parents' fears about themselves as parents, the kids' feelings about not belonging no matter what they did. And they were an incredible artist. I mean, that's the part that's, Marsha talked about a tulip in a rose garden, the idea that it's not necessarily a bad thing, it doesn't align, right? The person's interest in the environment just don't align. And so by talking about the fact that they shared similar fears and that the parents were able to understand that even though they had their own desires for their kids, that not everyone was going to fit in line with that, parents are more willing to do things that the kid had been asking for a really long time, in terms of wardrobe changes, in terms of activities that were not necessarily quote unquote the family activities. You know what I mean? Like everyone went to the same summer camp and they were like, I don't want to go to that summer camp. And the parents are like, but that's what we do. And it's like, well, yeah, if that's what you do, if that's what you're into, but I'm not. So
I love that. I love that that's what we do. And then we have this, the tulip, right, in the rose garden who isn't about that. And the ability to shift that in the family, I would imagine, I've been up against that where it feels impossible to shift. So I appreciate that. I appreciate that as an example. I'll
wrap that example. I'll wrap that example in a bow for you, because then I do have to go. So the nice part was a lot of the art was a little darker, and so there was like a little bit of a morbid motif to a lot of the art that was getting done. And the parents' responses, even though the art was maybe guess that art is subjective, I thought it was amazing. The parents usually had like a disgust response because of the content.
Right.
And so, a couple months in, we kind of had these conversations. Things, parents were getting better, more communication, and the adolescent had composed a piece of work that was even kind of further down the continuum of dark, and it was pretty morbid. And the mom walks in and is like, "That's beautiful." And it was this first moment of, getting past the initial content and seeing the work and the effort and what this represents about their kid and how proud their kid was. And so that was like a really cool moment.
Very cool. Okay, so I know in the interest of time you have to go. I want to thank you for your wisdom and insight, and I'm sure people are going to find this helpful. And just in case anybody wants to reach you, I'd like to give an opportunity to just provide us with the contact information you would like if someone wants to reach out to you.
Sure. Typically, email is best, and depending on the coast, on the West Coast, it would be jay@dbtsandiego.com. On the East Coast, it would be Jason, Jason, at newyorkcbt.com.
Thank you so much. That was a lot of fun, and I look forward to connecting with you again.
Thank you for the opportunity, Adam. Wish you well.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.